Hello, ladies and gentlemen. This is Dr. Haris, a graduate of dental surgery from Lahore. Now, today we'll discuss about the muscles of mastication. It is a very simple and a straightforward topic, and I'll try to make this very enjoyable for you. So, we have four principal muscles of mastication, which are namely the masseter, the temporalis, the medial, and the lateral pterygoids. All of them have a common nerve supply, and the first muscle which we're going to discuss about is the masseter muscle. Now this muscle originates from the inferior border of the zygomatic arch. It inserts on the lateral aspect of the ramus of the mandible, and the action of this muscle is to elevate the mandible or close the mouth. So this muscle can be felt whenever we clench our teeth and we touch our cheeks. We can clearly appreciate the action of this muscle. So, the next muscle is the temporalis muscle. This muscle, like its name, it originates from the temporal fossa and it inserts on the medial aspect of the mandible on the coronoid process. Now, this muscle is the principal elevator of the mandible. It is responsible for closing of the mouth, and it also is responsible for retrusion of the mandible. Now in this picture, we can see in the green color we have the lateral pterygoid muscle, and in the red color we have the medial pterygoid muscle. The lateral pterygoid muscle is the principal depressor of the mandible. The responsibility of this muscle is to open the mouth, and this muscle is originating from the lateral pterygoid plates of sphenoid, and it inserts on the medial aspect on the neck of the condyle. Now this muscle is extremely important. This muscle acts bilaterally and it pushes the neck of the mandible forward. Whenever we open our mouth, we can clearly appreciate it that our lower teeth first travel a distance forward and then they translate down. So it is this muscle that basically pulls our teeth, the lower teeth, forward. So the next muscle is the medial pterygoid muscle, and this muscle is also known as pterygoidus internus. It is originating from the maxillary tuberosity and it inserts on the medial aspect on the angle of the mandible, and this also assists in closing the mouth and elevating the mandible in mastication. So we've talked about the four muscles of mastication. The medial pterygoid, the masseter, and the temporalis are the muscles which elevate the mandible or close the mouth, and the lateral pterygoid is the muscle which opens the mouth or depresses the mandible. The lateral pterygoid is also responsible for side-to-side movements. So now we come across the clinical aspect of these muscles. Now every muscle has a normal property of contraction. Now whenever we come across a situation when the patient has hypercontracted muscles, his teeth are in very bad condition, like we can see in this picture. This is known as bruxism. This happens when the muscles are so tightly contracted and the biting force is so great that the tooth substance begins to dissolve away, and the tooth substance reduces in its amount, and this is extremely painful because the dentine is being exposed, which is sensitive, and second, this has a very bad aesthetic appearance. So what we have to do is that we have to reduce the tone and the contraction of the muscles of mastication. And how do we do it? We do it by certain simple non-pharmacologic ways, which includes use of splint, which is an intraoral appliance. We go for physiotherapy or hot oil massages. If this management fails, then we have to go on the surgical options, or we have to go to the pharmacological options, which includes the use of certain medicines, such as the muscle relaxants. There is also a use of the botulinum toxin. Now, all of the muscles of mastication are supplied by a single nerve, and that is the mandibular division of the trigeminal nerve. If this nerve is damaged, the patient will be unable to chew and unable to open or close his mouth. So in every surgical preparation, in every surgical operation, it is important that we preserve this nerve for the betterment of the patient. So this was about the muscles of mastication. I hope you found this video enjoyable and you learned from it. If you have any questions, ask in the comment section below. Do not forget to subscribe to my channel. This is Dr. Haris. Thank you very much.